Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Excess screen time in children linked to delayed child development. A new study conducted in Japan highlights the potential negative effects of excessive television screen time on child development in early childhood. The research, published in a recent issue of JAMA Pediatrics, explores the relationship between screen time and developmental outcomes in children aged 1 to 3 years. Although pediatric guidelines recommend that screen viewing be avoiding for infants younger than 2 years and limited to 1 hour per day between the ages of 2 and 5 years, many children fail to adhere to these recommendations. Excessive screen time in children younger than 3 years is associated with adverse effects on cognitive, language, motor skills, and social behavioral development. Aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code or access the link in the description box below. Eczema treatment cream Roflumilast met primary endpoints. Arcutis Biotherapeutics announces positive phase 3 trial results. Arcutis Biotherapeutics announced that the INTEGUMENT-PED pivotal phase 3 trial of Roflumilast cream 0.05% in children aged 2 to 5 years with mild to moderate atopic dermatitis or AD met its primary endpoint and all secondary endpoints. In the study, 25.4% of children using Roflumilast cream 0.05% achieved skin improvement by week 4 compared to 10.7% in the control group. Improvement was noticeable as early as week 1. Roflumilast cream 0.05% is a once daily steroid-free topical cream in development that is formulated to deliver drug without disrupting the skin barrier. INTEGUMENT-PED enrolled 652 children aged 2 to 5 with a mean body surface area of 22% overall and a range from 3 to 82%. The data reinforced the well-established efficacy, safety and tolerability profile of Roflumilast cream in atopic dermatitis across the INTEGUMENT program. Traumatic brain injury may be a risk factor for cardiovascular disease even decades later. A new review paper by investigators from Mass General Brigham presents key findings on long-term associations between traumatic brain injury or TBI and cardiovascular disease, highlighting that nervous system dysfunction, neuroinflammation, changes in the brain-gut connection and post-injury comorbidities may elevate the risk of both cardiovascular and cognitive dysfunction in TBI survivors compared to the general population. The review, published in the Lancet Neurology, emphasizes the need for future cardiovascular research, surveillance, and interventions in TBI survivors. The review suggests that non-neurological effects of TBI such as cardiovascular, cardiometabolic, and endocrine dysfunction may act as intermediaries contributing to neurological disease decades after TBI. For example, hypertension, hyperlipidemia, diabetes, and hypopituitarism can negatively affect cognitive function and are established risk factors for dementia. These cardiometabolic risk factors have also been found to be more prevalent in those with a history of TBI, as demonstrated in over a dozen studies on military personnel, athletes, and the general patient population, which are summarized by the authors of the review. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.